extraoral exam from Westmoreland County Community College Dental Hygiene Program as performed in our dental hygiene clinic. The examination of a patient actually begins from the moment you retrieve the patient from the waiting room. You observe the patient's posture, gait, size, notice if they cough or stutter.
And then we would go ahead and tell the patient what we are performing. Miss Emily, today I am going to perform an extraoral exam on you. This may feel like a mini massage, but it's just to get a baseline for what's normal for you. If anything's uncomfortable as we do this, please let me know. Okay? Do you have any questions? Okay.
Okay, the start of the extraoral exam. So the submental nodes located on the sublingual salivary glands palpate using the index and middle fingers under the chin and thumbs on the border of the mandible. Using a small circular motion, gently roll your fingers, moving the gland toward the inferior border of the mandible in order to feel any swelling of the lymph nodes. Continue towards the submandibular nodes located on the submandibular salivary glands. Continue rolling with your index and middle fingers along the mandible in an outward direction. Using a small circular motion, gently roll your fingers, moving the gland toward the inferior border of the mandible in order to feel any swelling of the lymph nodes. You will end at the angle of the mandible. Tonsillar nodes. Take your index and middle fingers and move them downward and medially to rest on the area of the palatine tonsils. Gently press against the tonsils while you roll your fingers in a circular pattern over each gland. Next, move your hands into position to palpate the parotid gland, which is located in front of the ear. Using bilateral palpation, gently roll your fingers over the area of the parotid gland. Palpate the outline of the gland first, and then continue to fill in as the outline as you palpate. This gland is not palpable in health. Move to the preauricular nodes, which are located in front of the ear. Position your fingers at the top of the ear and palpate the area immediately in front of the ear, moving from top to bottom until you reach the bottom of the earlobe. Move on to palpate the TMJ by gently placing your index and middle fingers over the location of the mandibular condyle and asking the patient to open and close.
Go ahead and open and close and open again and close.
You should be able to feel the condyle moving outward against your fingers, noting any clicking, popping, or irregular mandibular movement. While observing the mandibular movement, you also would note any deviation or deflection to the right or left upon opening or closing. Repeat the palpation of the TMJ from the back position. From the TMJ area, move on the postauricular nodes, which are located behind the ear. Position your fingers at the top of the ear and palpate the area immediately behind the ear, moving from top to bottom until you reach the bottom of the earlobe. From the ear, move on to palpate the occipital nodes. Ask your patient to tilt their head forward. With the index and middle fingers of both hands, start at the nape of the neck and palpate up the skull until you locate the superior nuchal line. Using the 2 fingers on each hand, palpate the nuchal line by moving your fingers in a circular and upward motion. Move your hands laterally and follow the line of the bone until you reach the mastoid process on the side of the skull.